going to talk about around four ethical dilemmas surrounding COVID 19. So, the first dilemma is about distribution. So, there were a lot of companies that were trying to make the vaccine, and there were a lot of countries that were waiting for the vaccine to be done. So, when the vaccines were done, there were a lot of first world countries that were kind of securing their vaccines, and so that left third world countries or countries without the same level of resources that they had, fighting over less vaccines that they left for everyone else, right? And so you have this sort of national interest against like a world or a global interest. So you have to think about how much will you take for your country and how much will you really leave for the rest of the world. Although the what you really wanted at that moment was that your country was as healthy as possible, because obviously it's a pandemic, so it's a really hard subject, a really hard experience that everyone had. So the second dilemma would be about autonomy and basically public health. You know, countries didn't ask their citizens to take the vaccine, but rather there was a mandate that said you had to do it. And that broke out a dilemma about bodily autonomy and whether the government really could say what we put in our body, and if we and that we should really have the capacity, that we have the capacity, and that we should um, know what we want to do, and it shouldn't be mandated to us. But at the same time, you had to think about the public health crisis that your country was in, right? And so you were thinking about yourself as an individual, but you also had to think collectively. For example, in my case, um, it was hard because the vaccines were kind of rushed, and I had my doubts about it. But at the same time, I have family, I have grandparents that are old now, and so uh, it's a risk. It's a risk for everyone else, and so that's the dilemma you have inside. You have to think for yourself and for everyone at the same time. The next one is about uh, sort of information surrounding the vaccines. For example, um, there was a lot of misinformation in social media. There was a lot of misinformation that everyone thought they knew was right, but not necessarily. And we also saw some companies or even some governments uh, trying to not let these social media companies spread that much information about COVID and about the vaccines. For example, probably there were a lot of things like side effects that the vaccines had that governments maybe didn't want people to know, because if they knew, many would be against taking the vaccine. Maybe not everyone, but some of them might. And what was important for every country was for people to take the vaccine so that the health crisis would be done. And so the dilemma was, should we say enough to them? Should we not say enough to them? Um, because this is a crisis and we need to end it, right? And the last the last dilemma would be about vaccine trials. Like I said before, um, vaccines were rushed, and there was not much time because of the crisis we had in the world, and there were a lot of trials that were done too fast, and that sparked doubts. Uh, and the dilemma there would be, should we push it too far, not knowing maybe all the side effects that the vaccine might take, because there's not enough time for enough trials in the long run, right? And so should we give people this vaccine? Should we make this for them without telling them about the side effects, or without making the proper trials in the long run? And should we say it's okay and it's safe even though it might not be safe? Those are my four ethical dilemmas for COVID.